Good afternoon, and welcome to the Flint Journal building here at Michigan State University in the city of Flint. I'm Aaron Souza. I am the interim dean at the College of Human Medicine, and I have had the pleasure and honor to work with the community of Flint and Michigan State University and the college on developing public health programming here at the Flint Journal building for many years. And I'm delighted to say we are gathered here today for an important announcement about how public health will be expanding here in Flint. It's my honor to introduce the 21st president of Michigan State University, Dr. Samuel L. Stanley, Jr. From his arrival at the university in 2019, he has advanced the safety, diversity, and excellence of Michigan State University, while the strategic planning he has led will guide the university to the year 2030 and beyond. He's been a great friend of public health throughout his career. He's been a great supporter of the community of Flint and has just been incredibly useful and supportive as we've developed programming here in Flint in the support of the community. President Stanley.
Well, thank you so much, Dean Souza, and thanks to all of you for joining us for this very important announcement. I want to particularly acknowledge Ridgway White of the Charles Stewart Mott Foundation, who is with us to speak today, as well as Mayor Neely, Representative Kildee, Ms. Lewis, and from Michigan State University, Dr. Norman Beauchamp, and Public Health Program Director Wayne McCullough. I also want to acknowledge the Mott Foundation Board for its support, and the Michigan State University trustees who are with us remotely, Trustees Diane Byram and Melanie Foster. And I want to recognize MSU's C.S. Mott Endowed Professors of Public Health, Jennifer Johnson, Deborah Verholden, Dr. Mona Hana Atisha, and Todd Lucas for their leadership and dedication to the people of Flint. For many years, Michigan State University has been driven to find sustainable solutions to some of the world's most pressing problems by working with people in the communities where they live. MSU's community-based approach to healthcare, education, and research is a great example of how we make a difference in every part of Michigan. Michigan State University is fortunate to have partners who share our vision and strengthen this mission. This is particularly true in Flint. Michigan State has proudly worked with the Mott Foundation over many years to support the people of Flint through their schools, local government, healthcare, and other partners. Working alongside the foundation and regional partners has allowed us to create a new model for public health right here in Flint, a model that empowers the community, supports research, learning, and understanding, and, importantly, improves health outcomes for children and families. So I'm pleased to announce the expansion of the partnership between Michigan State University and the community, supported by a new $25 million grant from the Charles Stewart Mott Foundation to advance public health in Flint and beyond. Today's announcement builds on the nearly $12 million in grant funding from the foundation starting in 2012, which led to the College of Human Medicine's expansion and relocation of its public health program to Flint. This new transformational grant will support additional endowed faculty positions to expand the college's public health program here. The funds will allow us to add approximately 18 new tenure-track faculty members, including more than 8 named professorships. That will grow the program to more than 25 tenure-track faculty and approximately 70 faculty members overall. We plan to engage the Public Health Program's Community Partner Advisory Committee to help determine which public health areas should be priorities for the program's recruiting focus. I'm so excited about the opportunities this program will open to continue to make a positive difference for community members. On behalf of the university, I want to express our deep gratitude to the Foundation for its generosity and ongoing support for this and other Michigan State University activities, and for sharing our vision for a healthier Flint community. Through this partnership, Michigan State University is fulfilling our mission of providing knowledge-based services to improve people's lives. The Foundation's support will help us elevate excellence, strengthen the community, and advance equity. This is the next step in the evolution of community-based research at Michigan State University, and I look forward to more to come. It is now my pleasure to introduce Ridgway White. He is the president and CEO of the Mott Foundation and chairman of its board of trustees. Ridgway is absolutely dedicated to finding ways to help the people of Flint. I've learned that when the water crisis arose, Ridgway and the Mott Foundation didn't wait for the state or federal government to intervene, but rather jumped in to fund a return to safer water source for the city. That speaks volumes about his and the Foundation's commitment to the people of Flint. So with that, please join me in welcoming Ridgway White.
Thank you, President Stanley and Dr. Sousa. A global pandemic, the safety and affordability of drinking water, chronic disease, mental health, and issues of addiction. These are the public health challenges of our time, challenges faced by Flint and by communities all across our country. Just over a decade ago, MSU and Mott began talking about expanding the university's public health presence in Flint, with a focus on collaboration and community. It was an idea that turned out to be just in time. Shortly after we cut the ribbon on this facility and welcomed the first C.S. Mott endowed professors of public health, the entire city was affected by the Flint water crisis. I still remember the exact moment I learned that Dr. Monahan and Atisha's research showed a spike in the lead levels among Flint's children. Her research provided evidence for action. And her work with the Pediatric Public Health Initiative, that is a joint effort of MSU and Hurley Children's Hospital, helped Flint kids and families navigate their way through crisis. Dr. Mona subsequently led efforts with the CDC's Flint Lead Exposure Registry to track impacts on health and connect residents with resources. She also advocated for inclusion of the National Pediatric Fruit and Vegetable Program, prescription program in the 2018 Farm Bill. Her work is just one example that is making a difference with MSU, that MSU is making a difference in Flint. And the way it's helping to inform public health policy and practice for our state of Michigan and our nation. We can point to so much good work by all of MSU's experts. Dr. Jennifer Johnson was the first public health rock star to come on board as a C.S. Mott endowed professor. She has not only explored the experiences of women in Flint, but also has created an action network to address needs identified through the Flint Women's Study. From the moment I met Dr. Deborah Verholden, I knew she would be a powerful advocate for Flint. What I didn't know yet was that she would also become a leading voice nationally for how data-driven decision-making can reduce racial health disparities, particularly around COVID-19. Dr. Todd Lucas is exploring the important issues of how stress and injustice affect the health of individuals and communities. And nobody gets me excited about maps like Dr. Rick Sadler. His GIS analysis and his data visualizations have illuminated local needs. They inform decision-making around water issues, food distribution, educational challenges, and more. I could go on and on about all of the MSU faculty and community-based staff, but we'd be here all day. Suffice it to say, their work and their leadership is world-class. So when MSU began talking with Mott again about the opportunity to further expand this program in Flint, we wanted to help make it happen. Dean Beauchamp, I think I said full steam ahead, right? Our founder, Charles Stewart Mott, believed every person exists in a kind of partnership with their community. MSU knows this too. They know that an individual's health depends on the health of the community and vice versa. Their faculty and staff are working in partnership with Flint residents to improve the health of individuals, our community as a whole, and communities across the country. That's why the Mott Foundation is pleased to support the expansion of this program with a new grant of $25 million. I want to say thank you. First, thank you to Dr. Aaron Sousa and to Mott's own Neil Haggerty. They rolled up their sleeves and figured out how to get us to this point, how to get this done. And your work is amazing. To President Stanley and the MSU Board of Trustees, to the faculty and staff who are already working on behalf of Flint residents and people all across our country and world, and to those who will soon join you in your extraordinary work. The Charles Stewart Mott Foundation thanks you for your vision and commitment, and we are proud to support you. Thank you.
Thank you, Ridgway, for your vision, your support, for all the shared effort and perspiration and hard work that is taken to make this happen. And I just really appreciate personally what that has meant to the people of Flint and to our community and our colleagues across the university. We have some additional speakers to help celebrate that and talk about that kind of work and what that means and why a grant like this is so important. We have Wayne McCullough, the Interim Director of the Division of Public Health and the Director of the Michigan State University Public Health Program, Dr. Norm Beauchamp, the Executive Vice President for MSU Health Sciences, the Mayor of Flint, Sheldon Neely, Congressman Kildee, who joins us by Zoom, followed by recorded messages from Senators Debbie Stabenow and Gary Peters, and Yvonne Lewis, who has been with us from the beginning, the founder and CEO of the Center for African American Health Consciousness and a very special community partner. So it's now my pleasure to welcome up Dr. McCullough.
Thank you, Dr. Sousa, for your extraordinary leadership and long-term vision to not only support bringing the MSU public health to Flint, but your unyielding dedication to enhancing the health of the Flint area residents. I also want to thank the Charles Stewart Mott Foundation for the initial investment that enabled the recruitment of the public health researchers and instructors in the public health program, as well as the creation of the Pediatric Public Health Initiative to come together with community collaborators. Our three interrelated groups embedded in the Flint community have partnered on efforts with a community participatory public health model. We're addressing the social determinants of health, advocating for policy reform, encouraging healthy behaviors, mitigating chronic diseases, and so much more. Together, we have reached the first plateau, and this new grant from the Charles Stewart Mott Foundation will further enable us to address community-identified health disparities, greatly extend the recruitment and training of a legion of researchers and the next generation of public health students. And it will deepen our commitment and collaboration with community partners to ensure we continue our research, instruction, and the Pediatric Public Health Initiative. So together, we will bring sustainable public health solutions to Flint and beyond. At this point, I have the distinct honor of introducing Dr. Norman Beauchamp, the Executive Vice President of Michigan State University Health Sciences.
Thank you, Wayne, and thank you for your incredible work. This is such a special day. It sends a message of a commitment to health, hope, and healing for all. Health, hope, and healing for all, which is the mission of health sciences at Michigan State. I want to thank Dean Sousa I arrived here in 2016, and his passion for the work here with the wonderful people of Flint and the amazing faculty has been an inspiration to all of us. I want to thank Ridgway and the C.S. Mott Foundation. Your generosity and trust in Michigan State has been phenomenal. And I also want to call out your approach, your innovation to impact, using a P3 mechanism to bring together partners to ensure both faculty and facility. It's truly extraordinary. I want to thank most of all the people of Flint. MSU is community-based. We can't do our work unless we're invited in to be partners. And the people of Flint, your gifts, your resources, your skills, your intentionality has been inspirational to us. And we're so thankful for you allowing us to come in and be a part of this work. And please know that this work echoes. President Stanley just took us through a strategic planning process that was inspired by the work that's being done here in Flint. And now we will mobilize the entirety of the university to take this address of health disparities statewide and beyond. Martin Luther King Jr. said, "Make a career out of humanity. Make a career out of humanity, and this gift will allow us to enable more people to dedicate their career to humanity." So we couldn't be more thankful. With that, it is my pleasure to introduce Mayor Neely.
Good afternoon. This is another great day that God has made, and He chose to smile upon the city of Flint once again by way of the partnerships. I want to thank Ridgway White and the Mott Foundation. I want to thank Dr. Stanley and Michigan State University for the partnerships. The residents of the city of Flint will benefit from this partnership. This all boils down to the level of quality of life for people. Health is quality of life. There's really little quality of life if you have less health. With the partnerships that we see here today, this will enhance the needs of this community. We talk about healthcare disparities, especially in communities of color or low to moderate income areas. We need programs like this, partnerships like this, to make sure that we can deliver a better quality of life. In times of crisis, the city of Flint has already seen through its water crisis and with the worldwide pandemic, we've been able to close the gaps with partnerships like this. The theme of this, when I talk about partnerships, this is how we work together and win together, whether you're black, white, rich, or poor, from a affluent community to a poor community. This is what we have to work together as a United States. Let the city of Flint bring about a level of change in the way we think around health care. We need more partnerships like the one you see today. The needs of this community has been matched with the resources from the Mott Foundation, with the great minds of people like Dr. Deborah Furholden and Yvonne Lewis, the boots on the grounds from the staff people. We are doing great work. It is a benefit to be able to have partnerships that's fruitful to whereby people have a better quality of life. And that's what we see here today. So I encourage, for those of you that are watching, engage the level of partnerships wherever you may be, in the state of Michigan or outside of the state of Michigan, in Genesee County, the city of Flint. Engage these pieces because we can enhance the partnerships that will make things better for all of us. It is my great pleasure now to introduce one of my friends, my big little brother. We attended the same high school here in the city of Flint, a different decade. I'll let you guess who's the oldest. But my friend, Congressman Dan Kildee, you'll be hearing from him, and God bless you.
Well, thank you so much, Mayor Neely, class of '86. Thank you for that introduction. And I'm really happy to be joined here by so many friends, President Stanley, my longtime friend, Michigan State Board Chair Diane Byram, and of course, the Mott Foundation President, Ridgway White, who personally and through the foundation has done so much for our community, for the people of Flint. Today, we're here to celebrate this incredibly generous gift by the Mott Foundation that will help Michigan State University expand public health programming in Flint and to continue to bring top public health care to our community. So again, thank you, Ridgeway, and the entire Mott Foundation for that incredible act of generosity and the investment in our future. Providing good quality health care is obviously vital for the well-being and economic vitality of our community. MSU and the Mott Foundation have worked to address these needs in our community for a long time. For decades, in fact, MSU and its faculty have worked together with students and to provide high-quality health services for the Flint community. MSU brings healthcare organizations, community-based partners together to collaborate on projects that improve people's access to healthcare and reduce health disparities in our community and in our state. Public health leaders have also been central in combating the coronavirus pandemic, which, by the way, is the reason that I'm here virtually. I'm in day 10 of the COVID-19 protocols. I tested positive and I'm getting through it. But obviously, we've had this challenge, and I'm now part of those statistics. These last couple of years have highlighted the critical importance of a robust public health infrastructure in keeping our community safe and healthy. And it's been mentioned, Michigan State University's Flint-based public health experts have implemented programs in the community and beyond. And I'll highlight just one of MSU's many incredible public health efforts, Dr. Mona Hanatisha's work on the Flint Registry. I helped to create the registry along with Senators Stabenow and Peters in 2016 in the Flint aid package to help Flint residents who were exposed to lead in their drinking water and to get connected with resources in the community. It's the goal for the registry to become a model for public health in this country and to help the people of Flint continue to recover from the Flint water crisis. And it's been doing that. The Flint Registry has become an integral part of the healthcare system for Flint residents. So far, more than 18,000 residents have enrolled and made nearly 25,000 referrals for services within our community. That's just incredible. I fought also with my congressional partners to create the registry and have continued to push for its federal funding. Last year, in fact, we were successful in securing $4.5 million for the program, and we're working to secure more funding this year. The Mott Foundation's gift that we announced today will help MSU improve the lives of communities in mid-Michigan. This funding will support our healthcare providers, our workers, patients during this ongoing pandemic and beyond. Their investment will continue to make our community and our state healthier and make it a more vibrant place to live. So thanks to all of you for your incredible involvement in this day. It's a day to celebrate, and I very much appreciate being asked to be a part of it. Thank you.
Hello to everyone taking part in today's important announcement. Thanks to Michigan State University's College of Human Medicine for everything you do to keep the people of Flint and Michigan healthy. And special thanks to the C.S. Mott Foundation for providing this public health grant and for your amazing support for the Flint community. We've made a lot of progress in recovery efforts, but we also know that we can't let up. There's still so much more work to be done. And that's something I've been focusing on every day in the U.S. Senate. Early on during the crisis, that meant ensuring that Flint families had ready-to-feed formula for their babies that didn't require mixing with water. It meant working to expand Medicaid to cover Flint children up to age 21 and people who are pregnant. We also know how important good nutrition is to mitigate the effects of lead exposure and help children grow up healthy and strong. And that's why MSU and Hurley Children's Clinic launched a program I was so proud to support, in which families receive prescriptions that can be redeemed for fresh fruits and vegetables at the Flint Farmers Market right next door. In fact, Flint was the model for this innovative program, which I expanded nationwide in the 2018 Farm Bill. And I worked closely with Michigan State and Senator Peters and Representative Kildee to create the Flint Registry and to ensure that vital funding continues. Last year, we secured $4.5 million for the registry, which will help ensure that Flint families receive the continuing support they need. Making Flint whole requires all hands on deck, and this community couldn't have better partners in that effort than Michigan State University and the C.S. Mott Foundation. Thank you all for being here today and for all you do to support the people of Flint. I'm so proud to be your partner.
Hello, I'm U.S. Senator Gary Peters, and I'm so pleased to join you today to celebrate the continued partnership between Michigan State University and the Mott Foundation to support families and residents in the Flint community. And I want to thank both Mott and MSU for all that you're doing to help Flint. You know, time and time again, Flint has demonstrated its resilience over the years. And together, Flint has made incredible strides. And it's a testament to everyone in the community banding together to overcome adversity. And that's why I'm just so excited about this announcement that will support Michigan State University and its extensive engagement with the Flint community to improve public health. This investment from the Mott Foundation will not only help MSU to further research and to understand various public health challenges, but also expand its outreach capabilities to serve even more Flint residents. The Michigan State University College of Human Medicine, located in the very heart of Flint's downtown neighborhood, has played an absolutely vital role in addressing the city's water crisis and continues to spearhead initiatives to remediate lead exposure and its impact on human health. There is no doubt in my mind that this investment will build on MSU's successes for years to come. Please know that I will continue supporting efforts to ensure that every Michigander has access to clean, safe drinking water, whether by helping to enact the bipartisan infrastructure law, which secured significant funding to replace lead service lines, or strengthening the federal lead and copper rule. I was proud to help champion Flint Registry hosted by MSU, which played a critical role in Flint's recovery from the water crisis by connecting families to services needed as a result of their lead exposure. I will also continue pressing for strong funding for the National Institute of Health to support MSU's efforts. So thank you all again for your hard work to improve public health in Michigan and all across our country and lift up the Flint community. I look forward to continue working with all of you.
Thank you. My name is Yvonne Lewis, and ensuring that the community is adequately prepared to make informed, quality health and health-related decisions is the foundation of my work. In 2020, we identified a need to provide a local context to a global pandemic. And we're excited and proud as we approach the 100th episode of the Flint Community Webinar on Coronavirus. We thank you, the City of Flint, non-governmental agencies, service providers, and residents that join us every week to share firsthand access to credible information and current resources in Flint community. My children and I, along with other family members, have been impacted by the Flint water crisis, the coronavirus pandemic, racism, and other health inequities and disparities. Though personal, it's not just about me. Flint is not just a short-term quick fix, rather a commitment that goes beyond my years. When the work gets hard, and it does, I and others stay at the table, sharing a perspective of community so that the community voice can be heard. Michigan State University and the Charles Stewart Mott Foundation have provided resources to build mechanisms that allow us to continue and expand our reach beyond ourselves. We have built a greater sense of why a community-driven research agenda is so important and extremely valuable. The partnership between the community, MSU, and Mott gives real credibility and credence to the work, leading to a strengthened public health efforts in Flint. The grant represents a beacon of hope that will elevate community-led solutions to the issues we face. It is important to create a safe space for community voices to be heard, providing the opportunity for our voices to contribute, to be included at every level of the research process. To develop these effective resolutions must be intentional. Together, we will ensure sustained positive change in our community. Working alongside with community partners, the C.S. Mott Endowed professors of public health have been boots on the ground for us, building trust, advocating for the people of Flint, and partnering world-class research with opportunities to make a difference. Let's hear from them now.
The things that have happened in Flint would have wiped most cities off the map. There's a rich history here. The people here are really proud to be Flint residents.
The universe in me calls out to the universe in you. We are one.
This partnership is built on the foundation that for a community to be thriving, its residents have to be healthy.
The partnership between the Charles Stewart Mott Foundation and Michigan State University is the cornerstone for this work.
I believe in the power of community academic partnerships.
To do research that matters, you need good partners.
Commitment builds partnerships. Partnerships build trust. And the only way you can work with a person with the kind of work that we do must be with trust. And that builds a strong community.
One of the things that we aspire to is to create the opportunity for researchers to come into our community and be a part of our community and not just do research on our community.
We moved an entire family here. We live in Flint, we work in Flint, we play in Flint, we shop in Flint, we do everything in Flint, and they're my reason.
What this partnership has brought to our community is extraordinary.
Flint knows what Flint needs. This is how we get things done.
Without the community partners, none of what's happened here would have happened, and they're the spark that brought us here, gets us excited every day, and keeps the work going.
It provides an opportunity for community members not just to be consumers of research, but be participants in the process.
We're helping people have what they need to live better and happier lives.
There's an African proverb that if you want to go fast, go alone. But if you want to go far, go together. In this partnership, we've gone far. And there is nothing that we won't take on, no problem that we won't tackle to make sure that this community gets what it needs and what it deserves.
The College of Human Medicine makes a difference across the state through the collaborations of students, staff, and faculty with patients and community members across the great state of Michigan. The people of Flint have been extraordinary colleagues, have made days like this possible through their intelligence, their dedication, and their hard work. We are entirely privileged to be here with the people of Flint and people like Yvonne Lewis. Thank you so much for your words. The endowed Charles Stewart Mott professors of public health have made it possible for the college and the university to be useful and collaborative with the residents from our first work in mental health through the shared work in science during the Flint water crisis. We thank the Charles Stewart Mott Foundation and all the work of Mott Foundation Vice President Neil Haggerty and Kimberly Roberson and all of our partners in the Mott Foundation. We thank our hospital partners, Hurley Medical Center, Ascension Genesis Hospital, McLaren Flint, who all provided funding and support for the creation of the Division of Public Health dedicated to community-based participatory research in Flint. The Flint Community Foundation, the City of Flint, and the Greater Flint Health Coalition, among many others, have been key partners for our faculty on multiple projects and have brought new programming and opportunities to the residents of Flint. It's working. Since 2015, the MSU Public Health program in Flint has generated an overall economic return to the community of more than $93 million, added more than 80 jobs in the college and another 30 or more positions in partnering community agencies. We look forward to this next chapter in working with the Flint community to grow healthier and stronger. Thank you to the Mott Foundation, and thank all of you for being here with us today to celebrate this exciting announcement. And at this point in the program, I get to welcome Ridgway White and President Stanley back up to the podium to take questions that people put into the chat, I presume. All right.
As a reminder for our reporters, please use the Q&A feature in the Zoom format to ask your questions. Our first question comes from Carmen Nesbitt of Flint Beat. This will be for Dr. Sousa. Specifically, how will this grant help to expand the work that is already being done at the Flint Center for Health Equity Solutions?
So the Flint Center for Health Equity Solutions is an NIH-supported program. It's led by Deborah Verholden. There are a group of community principal investigators as well. It's a phenomenal collaboration. Having more colleagues, more faculty, more opportunities for community engagement absolutely will strengthen that as it goes up for renewal, and expansion actually allows the possibility of more centers like that here in Flint.
We're just giving our folks from the media a few more seconds to chime in with questions as they're typing those out, so stand by just for a few moments. The next question comes from Steve Carmody of Michigan Radio. I'll leave this open to all three of you. Is there any specific research projects this grant will support?
I'll take a first stab at that. This grant really supports adding faculty and opportunity. So those faculty then bring research projects. I think the key thing that the university and the community did at the outset was meet together, and our folks actually held dozens and dozens of community meetings, collected thousands of surveys, and then worked with a research advisory council from the community to come up with research priorities. Those were healthy behaviors, behavioral health, and chronic disease. Interestingly, that group then added us a piece for us that was that they wanted us to work on social determinants of health, and maybe more importantly, that we focus on interventions to reduce health disparities, and not just catalog what is, but rather work to make the world better and healthier for the people of Flint. That's the kind of work that we will bring people here to Flint to do. That is our focus, and that's what makes collaborations like this so special.
I'll do one last call for questions from our folks in the media. This next one is from Kim Kozlowski, Detroit News. Are there other partnerships like this? This being this partnership here in Flint. Ultimately, what is the hope for this work? Dean Sousa, do you want to start? And then we can turn over.
The last part of that?
Ultimately, what is the hope for this work?
The hope is to make the world a better place, right? A university, a land-grant institution like Michigan State University, a community-based philanthropic organization like the Charles Stewart Mott Foundation, they're here to make life better, to help us all be the most that we can be. And these partnerships lead to incredible programs that you've heard today because of that goodwill, that vision. and frankly, the community partnership that allows us to make a difference.
I would just add that this is an extraordinary model. So this is something I think that's the pattern essentially and sets the template for how we engage across the state. Michigan State University, we like to say, is Michigan's state university, and we're involved in every county of this great state. And so this is a template for how we can engage in public health in a way that's very, very effective, and we're going to continue to use it.
I might add to that question, for the Mott Foundation, we know that research is important and academia is important, but when you combine research and academia with community, it's impactful and it can change lives. And we've seen that for the past decade here with the MSU partnership with the Flint community, and it's changing lives in Flint and across the state and the world.
Thank you. I'll do one last call for questions, and then we can wrap it up. Just one more moment for media to put their questions in. All right, seeing there's no other questions, thank you all for your time today. Thank you to the members of the media who have tuned in. If there are any questions that our team can help with, please feel free to reach out to myself. You have my contact information if you have any further questions about today's news conference, and thank you all for joining us today.